I'm the coordinator for the Georgia SHIP program at Legacy Link. That means that I'm a Medicare counselor. I always like to start presentations off like this by saying that I'm not an agent, I don't have commissions, I don't have fees, you can't pay me, I don't want you to pay me. All of myself and all of the volunteers in the SHIP program, we're untethered from agencies, and so that gives us the freedom to be unbiased. You don't have to worry about any of us putting you into one plan or another because there's any sort of financial incentive, because there's not. So, so what all of our SHIP counselors do, there's 3 quick parts to this presentation. What all of us do, parts of Medicare, and then navigating Medicare.com, which SHIP counselors can do for you, but if you need to be able to do that on your own, I'll show you briefly how you can do that. All right. So for myself, and all of this is also on the flyer that we have over at the table up here, but for all of the SHIP counselors, I'm actually the only one that's not on Medicare. Everyone else has that experience, and my parents are just about to be, so I'm about to have that secondhand experience with it. Our job is to make sure that you understand your choices going into Medicare. It's things like how to enroll when you're first turning 65, or if you've delayed enrollment because stayed employed, how to enroll when that time comes. Most of what we do is actually plan comparisons. It's making sure that whatever prescription drug plan you're in or whatever Medicare Advantage plan you're in is the cheapest for you or covers the benefits you're looking for, whatever combination best suits your situation. And so it's a little difficult for me to just give a one blanket answer for everyone because so many people's situations will be so different. Coverage and costs. This means for people that have less income or more income, there are actually different systems that you get into. It'll depend on what zip code you live in, what plans are available to you, I'm getting a little bit ahead of myself, but there's a lot that goes into that. And then paying for Medicare prescriptions, again, that can be anything from financial assistance that's offered through the federal government to manufacturer discounts to even something like GoodRx or Needy Meds. If you have any billing issues, we can help you understand your bills. We can help you with submitting appeals if you think something should be covered and it's not right now. Every year there's a season called Open Enrollment, which is from October 15th to December 7th. That's when you can freely change from one plan to another, between prescription drug plans, between Medicare Advantage plans, from Medicare Advantage to original Medicare and vice versa. Anytime you need to do that, it would be during that window of the year. And then also actually applying for aid for people who have, for example, low income and who need financial assistance. And we'll go over those programs as we go on. The bulk of what I'm going to be talking about is the parts of Medicare. And I know that especially for people who already are 65 and over or who are caretaking for people that are, this might be familiar to you, but there may be something that you learn from looking over this. So Medicare is made up of 4 parts. There's your Part A, which is your hospital insurance. There's Part B, which is your medical insurance, so when you go to the doctor or the hospital but you're not an inpatient. There's what used to be called Part C, now Medicare Advantage, which is the private version of Medicare. And then there's Part D, which is prescription drug coverage. So Part A is, I don't know that there's any part of Medicare that's actually simple to explain, but this is, I guess, the least convoluted, not that that's saying much. So Part A is whenever you are, God forbid there's an emergency and you have to go to the hospital and you're admitted as an inpatient, Part A is what would cover you. For most people on Medicare, if you've worked, easiest way to explain it is if you've worked 10 years, so 40 quarters, your premium for Part A is covered, and it's hopefully not something that you even have to think about. This covers, skilled nursing facilities as well, home health, this would be under Part A, hospice care, if that's necessary. There is a deductible, so let's say that I'm in a car accident, and I have to go to the hospital, and I'm admitted as an inpatient, and I'm on Medicare. It would cost $1,600 is the deductible. And once you've got that covered, then your spell of illness is covered for I like to take, there's a expression that one of our counselors says that for Medicare, it's the same as when he was learning grammar. There's the rule, there's the exception to the rule, and the exception to the exception to the rule. I'm giving a condensed version of this, but generally speaking, for 60 days, your spell of illness is covered. So if you haven't, most people will be out of the hospital, not an inpatient for anywhere near that long, but for up to that point, it is covered. And that means that whether it's 1 day or 60, it's all covered under that deductible. There can be some copays for longer stays. Again, one of those exceptions is that you have reserve days that you can use over the course of your life, but if you get past that point, then there can be copays for those. If you have a situation where you need us to go into explicit detail about that, that's something where you may want to speak to a counselor one-on-one, because there are enough situations that are different enough that we may want to look into that. Now, if you did not work those 40 quarters, then there is a premium, and the premium that you would pay for Part A depends on how close you are to it. And so I don't know if that would necessarily apply to some of the parents you're taking care of, but if someone wasn't able to work or didn't work long enough, then there may be a premium for their Part A. There are still aid programs. One of the Medicare savings programs called QMB will still cover the Part A cost, and so if they're low income, that may be something we want to look into to help mitigate that. Part B is usually what most people think of when they think of Medicare. It's your medical insurance, and I said before that's your doctor's insurance, or when you go to the hospital and you're not admitted as an inpatient. This is a whole host of services. This is, again, doctors, clinics, labs, surgeries. If you need durable medical equipment, if you have to get preventive services like screenings or tests done, that's under Part B. There is a whole lot to this. This does not have one premium or one deductible ahead of time that covers everything the way that Part A does. This one is a little bit more traditional in its cost structure. There's a premium every month. For 2023, it's $164.90, and there are aid programs to help out with that if you're someone who's low income. On the other hand, if you are especially high income, that actually goes up through something called IRMA, but that is not something that affects most people. This has a deductible as well. After you pay $226, then there's a cost share between Medicare and you, where Medicare, again, for most of Part B, exception to the exception to the exception, I know, but for most of it, Medicare will take 80% of the cost, and you will cover 20% of the cost. There are programs that can help with that, and we'll get to that 20% being covered in a minute. Copays can be anything from $0 to there can be higher copays. It depends on what service you're getting covered, and if you have anything like a Medigap to help cover those costs as well. And if you're on Medicaid, if you're on a Medicare savings program, that can help cover these costs as well. Over on the table, there's a booklet of preventive I guess I'm getting a bit ahead of myself, but there's a book on preventive services. Anything you see in that is covered under Part B. So if they have Part B and they need, say, for example, a cancer screening, make sure that that's something that they know that they're entitled to without a copay. So I know we skipped a letter. There's a reason for that. But then next we have Part D, because it goes with Part A and B. If you have Part A and B, if you're on original Medicare, fee-for-service Medicare, so not private Medicare, you still have to get your prescriptions covered. And usually medication is covered under Part D instead of Part B, because if it's Medicare, of course there are exceptions to that, but usually you're going to get your name brand and your generic drugs covered under Part B. It also is where you get most of your immunizations. Most of the ones that aren't covered under Part B. There's a premium for that. One of the things that we do most commonly as SHIP counselors is plan comparisons for prescription drug plans, and you can see anything from $7.30 to the highest that we have now for this year is $118. Generally speaking, the higher the premium, the lower you expect the drug cost to be. And so, generally speaking, if you have a low premium, that may better suit people with no or few prescription drugs that they're taking. And it may be the case that if you're taking a lot of drugs, you may want a higher premium one because the cost per drug might go down. There is a deductible, or there can be. It could be no deductible, and you'll start getting the cost sharing for it immediately. It can go up to $505, and that maximum limit changes from year to year. You can already see why it might be important to have a SHIP counselor, because it doesn't take long for this to start becoming more and more complicated. These are offered through a private company, but they work with original Medicare, fee-for-service Medicare. So if you don't have your drugs covered through some other program, retiree insurance, the VA, TRICARE for life, it's important to have some sort of drug coverage, because there is a late enrollment penalty for people that don't have drug coverage when they could have gotten it and they weren't covered under something else. So let's say, for example, that you turn 65 and you forgo prescription drug coverage. For every month that you go without that, there's an extra 1% that's added onto the premium when you do get it later on. So that can add up pretty quickly. And that's meant to incentivize people to make sure that they have some sort of coverage, because it's cost share. Everyone is helping to lower the cost. There is a program that's offered through the federal government, through Social Security, called Extra Help, that can, help lower the cost of your drugs. It's income-based. Depending on your income, it might cut a portion off of your drug costs. It might cut almost all of it. If you're in the lowest income bracket for Extra Help, it can make, let me make sure I say, I think it's $10.35 for name brand drugs, and I think it's $4.15 for generic drugs. And that doesn't matter if the drug would be just barely over that cost, or if it's Eliquis or Xarelto or something that's much, much higher above that, or an expensive cancer drug, or whatever the case may be. Part D is also probably the part of Medicare that's going to have the most notable changes going forward, because this year and next year and the year after that and the year after that, there will be major changes to Part D. So going into 2024, that will change the calculus for some people on what ends up being the best plan for them. Again, if you have any questions about that, that's what us SHIP counselors are there to help with. And then the reason I skipped Part C is because this one mostly works by itself, which is to say, Part C is supposed to encompass the other three parts of Medicare. It's Medicare Advantage is what you'll usually hear it referred to as now. It covers your hospital insurance, it covers your medical insurance, usually it covers your drugs as well. It covers what would be covered under Part D. There are Medicare Advantage plans that don't cover drugs, but they're strongly recommended you not go for them unless you have drug coverage in some other way. Again, if you're VA, TRICARE for life, retiree insurance, etc. The cost, unless you're covered under an aid program, you're still going to have that $164.90. That's the Part B premium. But then there can be a separate premium. Usually there's not. Usually people will go into a premium-free plan, so it's just the Part B premium. But you can find one that has a premium that's higher than that. Again, generally speaking, you expect that if there's a higher premium, you're going to get more coverage or better cost in otherwise. At least that's the expectation. We can look to make sure that that's the case before you enroll, you speak to one of us. There's a health deductible that can range anywhere from, none to $1,000. And then there's a drug deductible, again, that's the same as with Part D, 0 to $505. And the reason that that deductible matters is that until you meet that deductible, you won't get that level of cost sharing that comes after the deductible. There can be co-pays starting as little as $0 just to see, your primary care physician might be $0 and then seeing a specialist might be higher. You can actually see that broken down on Medicare.gov for each Medicare Advantage plan. You also see that they'll have a maximum out-of-pocket, which is what it sounds like. Over the course of a year, it's the most, to briefly summarize, it's the most that you can pay for your care. And that usually, at least in my counseling, that usually ends up, the number I see most commonly is about $7,500. I know it can go lower, I know it can go higher. That should give you something of a ballpark of where that would be, though. They're offered through a private company. That's the main distinction from fee-for-service or original Medicare. That one is, of course, through the federal government. It does use a network. And depending on whether you have an HMO or a PPO, of course, if you're used to private insurance, you probably already know this distinction. An HMO is a network. You have to use that network or you're not covered. And a PPO, you should use that network because the cost will be lower. If you have to go out of network, you're still covered, but they won't cover you as generously. You might have a higher co-insurance or higher co-pays as a result. That's distinct from original Medicare, where as long as the doctor accepts Medicare, you can use it anywhere across the country. And then, once again, Medicaid and Extra Help are available to help people with Part C. Now, I probably don't need to tell you that there are a lot of extra benefits that can come with Part C. You can have things that aren't covered under original Medicare: dental, vision, hearing, Part B rebates, grocery benefits, over-the-counter benefits. And the reason I probably don't need to tell you that is that, especially if you're older, you see ads for them all the time. You will get mail for these all the time, especially as we get closer to open enrollment season. And that can make it seem like a really good option, and for some people it absolutely is. For some people, Medicare Advantage is probably the best option for their situation. But it is the kind of thing where you need to ask questions before you get onto it. So one common one is, are your doctors, hospitals, and other providers in the plan's network, are they covered? So to give you an example, here in Hall County, if you have United Healthcare, United and the Northeast Georgia Medical System aren't cooperating with one another. You can't, if you have United, you won't be covered in network going to the Northeast Georgia Medical System. So if you happen to have United prior to this year and you stayed in United, we would need to get you into another plan, or you would have to go somewhere that's still a network but outside of the Northeast Georgia Medical System. That's something that you need to look into. If you see a plan advertised, you need to make sure that it works with the doctors that are around you. Or you might need to get a ride a ways away. Will it cover out-of-network visits? Again, that's that distinction between HMO and PPO plans. If you need that flexibility, then you would need to make sure that you have a PPO or original Medicare, or not an HMO then. How large is the service area? Are you right at the edge of it? Is it something that covers your county? Is it your region? How large is that? Does your doctor need to get approval to make a referral? That's a big one. If you're on original Medicare, generally speaking, if it's something that Medicare covers and your doctor says you need it, Medicare will cover it. With Medicare Advantage, if it's something Medicare covers and your doctor says you need it and you get plan approval, then your plan will cover it. That does mean that there's an extra step that's added to it. If you're used to dealing with private insurance, you probably are already familiar with this step. If you are someone who's coming from original Medicare, then that might seem a little bit jarring. If you are taking care of your aging parents, this is something that you would need to handle. And you'll need to make sure that whatever plan you have them in makes this as easy as possible, if you can. And that's a process called prior authorization, basically getting permission from your insurance company to cover it. To give you an example, if you need to have a certain diagnostic test done, an MRI, and your doctor says you need it, of course Medicare covers MRIs, and you go to your plan might say, well, you need to get an x-ray first. Without giving names, that's a real example that we've come across. So something like that you'd have to keep in mind. How often is that required? Is it something that you need to get every time? What other extra benefits are provided? If it's something that they need the dental coverage, or they need vision, or they really do have a lot of over-the-counter drugs, that is something that you might want to consider. And if they do, are those worth it? And they may be. For certain people's situations, they very well may be. I don't want to make it sound like Medicare Advantage plans are all bad, because for some people, they are the best option for them. But I just want it's something to keep in mind, because you see a lot of advertisements selling them, trying to show that there is a little bit more to that. And then are there any other rules or restrictions? And that's something that we can look at as we assess the plans ourselves. So here's a nice little handy chart that one of our counselors made to compare original Medicare to Medicare Advantage. If you watch this later, thank you very much, George. You're excellent. So for original Medicare, for either one, I should say, you'll have that $164.90 as your Part B premium. There is if you're on original Medicare, a 20% coinsurance, because Medicare will take 80%, and then you'll be liable for 20% of it. And then if you're on Medicare Advantage, it'll depend on the plan. You'll be able to see when you look on Medicare.gov how much each of these procedures, each test, etc., will cost. And so the plan premium, if there is one, and then the cost sharing that's shown on the plan's details page. We haven't gotten to supplements yet, but you can get a Medigap if you are on original Medicare. You can't if you're on Medicare Advantage. If you are on original Medicare, any Medicare facility you can use. If not, then there's a restriction, potentially anyway, on Medicare Advantage. Again, that's your network that it's referring to. You don't need referrals if you're on original Medicare. Referrals are typically needed if you're on Medicare Advantage. If you're on original Medicare, you'll need a separate drug plan. In Medicare Advantage, usually, drug plans are included as part of the plan. They're built into it. So benefits, Medicare, this comes up all the time, but until Congress actually passes it, Medicare does not cover dental most of the time, vision most of the time, hearing most of the time, exceptions to exceptions, etc. But generally speaking, it doesn't cover those. But Medicare Advantage can have those, and often does have those, as benefits. And others as well. You may get a flex card that lets you pay for over-the-counter drugs or groceries. There is not a limit on out-of-pocket costs in original Medicare. Theoretically, the cost can go up to the sky, but put a pin in that for just a second. And then there is a maximum out-of-pocket if you are on Medicare Advantage. Which brings me to Medigaps. It's not technically a part of Medicare. It's not a letter part, but a Medigap is if you're on original Medicare. It's in the name. It covers some of the gaps that you might find in Medicare. Again, for most people, if you're on Medicare, you don't have financial assistance. 80% is on Medicare, 20% is on you. The short of it is that a Medigap will help to cover that 20% and some other costs, like the Part A deductible, in exchange for a higher premium. So, for example, if you're on a Medigap and you have, say it's $100 a month, just to make up a number here, and that's a Plan G, which we'll go into what that means, but basically it's a pretty comprehensive plan. It covers about everything. Then you'd be paying the $164.90 plus $100, so you'd be paying an extra $100 a month in a premium. In exchange, if you do need to see the doctor, if you do have an expensive surgery, there's effectively a maximum out of pocket now, because since that 20% is covered by your Medigap provider, it doesn't matter how high that would go, it'll get billed to them instead of being billed to you. So you go to the doctor bills Medicare, Medicare says, okay, this is approved, and then passes the remaining amount on to, not you, but to whomever your plan happens to be with, WellCare, State Farm, United, etc., whomever it is. So it'll cover the Part A deductible, part or all of your coinsurance. It says the price varies widely by plan. That's for Plan G, which again is the most comprehensive. There are cheaper ones that don't cover quite as much. And so if you need someone or if you need to cover someone, well, we'll get to that in just a moment. But if you need one of the cheaper plans, it may not cover as much, but it still will help cover some of this. There's a deductible. It's the Medicare Part B deductible, $226, or Medigap plans may have their own deductible before they start kicking in, which usually comes with a lower premium to make up for that. They're offered through a private company. They don't include prescription drug coverage. This is just for the Part A and Part B, gaps in that coverage. You would still need Part D as well. And so what you can think of it as, if you have original Medicare, here's your cost, is the $164.90. You have your Part D cost, which can be a little, it can be a lot, whatever that is, and then you have your Medigap. Put all of that together, and this is the minimum that you pay every month. But in exchange, if you have a Plan G, you have the $226 deductible, and this is now the ceiling you can pay. For the year, you don't have to worry about going over a certain amount because that's capped by your Medigap. Higher cost at the front end, but if you need it, you don't have to worry about continuing to go up. Medicare Advantage, you'll start off with that $164.90 again, and if there's no premium to your plan and the drugs are covered, this could be your floor. If you don't need it, this is where you're at, and so it can be more affordable for people that don't need the care or don't need it often. But the maximum out of pocket can make that go much higher. Even though there is a maximum out of pocket, it tends to be higher than having a Medigap as well. That's something that's easier for me to show with numbers when we actually do a comparison than to just explain it here. But that's basically the trade-off. Original Medicare, Part D, Medigap, higher cost per month, but if you do need it, you don't have to worry about how high it could go. How many digits we can stick on the end of a bill. And it's mostly redundant with one of the Medicare savings programs called QMB, because they mostly cover the same thing. If you're very low income and you have QMB, you wouldn't need a Medigap as well. All right. So these are the different plans. You'll notice it skips letters. It's Medicare. What can you do? But there are some plans that have fallen out that you can't get anymore, or for most people you cannot. These are a number of policies available in our counties. This wouldn't be true for the state overall, but in our counties, these are the plans that are available. For each letter here, you can see, and this is just to try to keep it standardized. This is for women. This is for non-smokers. This is for people who don't have a household discount, just to try to keep it as apples to apples as we can. It'll of course go up if you smoke, it'll go up a bit if you're male, but generally speaking, this is what you're looking at. For each plan, you'll see the lowest premium. If I do a search in your zip code, this may be the lowest that we could get. The median is in the middle, the highest. But because they're federally regulated, all of these plans, for a given plan, they have to cover the same thing. So there's not really much. There can be reasons you might want to go with a more expensive plan if you're worried about, for whatever reason, they're not paying, or if it's a very new plan and you don't want to take the risk, or if there's a household discount for your plan, you may want to, but otherwise, usually, you want to try to go with whatever the cheapest one that's available to you is, because by law they're required to cover the same things. All of these asterisks will cover your Part A deductible. All of these asterisks will cover your Part B coinsurance. They can cover your, excuse me, I see Plan A does not, my apologies, does not cover the inpatient deductible. They can cover your copays completely or partially. None of them, unfortunately, Mr. Bill over here reminds us that they don't cover the Part B deductible. Because I'm talking to caretakers of aging parents, it might actually be the case that your parents might qualify for something called a Plan F, which is not listed here because new beneficiaries can't get onto it. But if they turned 65 before January 1st, 2020, I think, then they qualify for a Plan F, which is the same thing as the Plan G, low, except it also covers the Part B deductible, that $226 per year, but usually comes with a higher premium. So that may be something that your parents might qualify for, that you might want to look into, but there's something that I haven't gone over with Medicaps. If you're turning 65, then you get what's called a guaranteed issue right. They cannot turn you down or charge you more based on pre-existing conditions. If you no longer have a guaranteed issue right, you can still get onto a Medigap potentially, but it might cost you more. And so for a lot of people that their parents didn't get onto one when they were first eligible to, you can still take a look at it and make sure that you can't. But they might very well have to go through underwriting first. And so while this seems like a good option financially, if you can get onto it, and it may very well be, but once they've already gotten past 65 and gotten out of their guaranteed issue right, we can look to see if we can find, as CHIP counselors, we can look to see if we can find an exception to get them into it, an enrollment period for it. Maybe under their circumstances we can, but otherwise the cost may be higher than we could find in a comparison that we do, because that assumes a guaranteed issue right. All right, so I've said this a few times, but there's a few different kinds of financial assistance that you can get onto. The first one is called a Medicare Savings Program, and there are different levels for this. So I won't go into all of them right now, but depending on their income, they might get onto a plan that covers their Part A or their Part B premium. So again, that's the $164.90 for the Part B premium and the $1,600 deductible, I should say. Or no, Part A premium, that's right. It can cover, in the most generous plan, it can cover your Part A costs, your deductible, your Part B deductible, your premium, your copays, your coinsurance. That's the one called QMB, Qualified Medicare Beneficiary, I believe. And that is, if they make below that amount, that is something that we would very much like to help them get onto, because that can help quite a bit with cost. It basically means that they're on Medicare and Medicaid at the same time. They're what's called dual enrolled. And when that happens, Medicare will pay first, Medicaid will pay second, and collectively that covers most of their cost. And at that point, we can look to see if being in original Medicare might be best for them, or there's some Medicare Advantage plans that specifically work with people who are dual enrolled, called DSNPs, Dual Special Needs Plans. And that means that they can get the benefits of Medicare Advantage, like dental, vision, and hearing, without having to worry about some of the higher costs for certain procedures that might come up, because that's covered since they're on QMB. And then there's another program I mentioned offered through Social Security called Extra Help. So that's specific to your prescriptions, and it covers not over-the-counter drugs, but if it's a prescription, name brand or generic, it can either cover a part of that cost or it can get it all the way to those thresholds that I was talking about earlier. And it can cover some or all of the premiums that they would pay. So again, I said that Part D plans have their own separate premium. Well, if you're on extra help, it will cover up to a certain point. So if you have an especially high premium, it won't cover all of that. But this year, it's 30 some odd dollars that it covers each time, which again, that's if the lowest one is $730 and the drugs themselves are being capped at, for generics, $415, that can end up going a long ways. And then we can actually do the applications in office, over the phone. If you need a virtual meeting for it, that's something that we can do with you. Now, I mentioned that preventive services are covered under Part B. So if they're on Part B, then there are certain things that they can go to the doctor for that will not carry with them, at least not on their own, a copay or coinsurance. So for example, every year there's an annual wellness checkup. Every year. So you get one when you first go on to Medicare, and then every year thereafter. And there's not a cost for that. Many of your screenings, tests, some of your vaccines, because some of them are covered under Part B, some under D. The B ones are going to be covered under the preventive services here. That's like your flu shot, for example, your COVID shot. And there's a limit to these. It's once every X months. It depends on what it is. So to give you an example, if you need colonoscopy, for people that are high risk, that's 24 months. For people who aren't considered high risk, that's once every 120, so 10 years that it's covered, but it's covered without cost. As long as you have doctor approval for it, and as long as it's something that Medicare covers, please feel free to take one of those preventive services books when you get out, because that will show you what all is covered. Now for Part D, all of your Medicare covered vaccines that aren't covered by Part B are included in those plans. So if they're behind on their vaccines, if they're behind on their immunizations, between B and D, that should help them get completely caught up. As for Medicare Advantage, because it covers what would have been covered by A and B and usually D, that will also apply to Medicare Advantage as well. Again, as long as it includes prescription drug coverage. So really quickly, even though this is something that SHIP counselors do ourselves, if you need to do this on your own, I'm just going to quickly show you. This is Medicare.gov. I'm going to show you how you can do plan comparisons really quickly. One moment. So if you come to the home page, just Medicare.gov itself, you can see I'm not logged in as anyone, so it'll look a little different when you actually do create an account. And in order to create an account, I should say, you'll need that red, white, and blue Medicare card because that actually has your Medicare number on it and your Part A or B start day, which is how we'll need to create an account. I can't create an account for you like you do for Gmail or whatever, where you make a username and password and that's about it. We'll need some confirmation that you're on Medicare, and that's the way that the government does it. So once you log in, you'll see at the top of the page, it'll say health and drug plans, and then you'll see where it's underlined here, find health and drug plans. You'll click on that. It'll have you put in your zip code. That's because the plans that are available to you will vary from zip code to zip code. And so when we actually do counseling one-on-one, it may very well be the case that the plan that your neighbor is in may not even be available to you because of that. Then you decide whether you're going to search first for Medicare Advantage, Medicare Drug Plan, Medicap, D, you can get Medicap. This is not something that you're locked into. You can switch freely from one to another, but for the purpose of this example, I'm just going to look at a drug plan, and then we'll go on to Medicare Advantage here in a moment. If you know that you're getting help from any of these programs, Medicaid, Supplemental Security Income, a Medicare Savings Program, extra help from Social Security, you can put that in there. If you're not sure, check that. That'll matter because, for example, if you're on extra help, the plans that it might suggest to you would be different because, again, since extra help can lower the drug cost and can pay for part of the premium, that might drastically change what ends up being the cheapest option for you. Whether you're logged in or not, you can put in your drug plan or your drugs that you're taking. And I strongly recommend you do because it'll show you which plans, it'll show you the cost for the plans of the drugs you're taking. So for the purpose of this, though, I didn't put one in, and this is what it looks like if you don't. It'll show you the monthly premium. This is Part D, so it says only drug coverage. When we get to Medicare Advantage, it'll cover the others as well. But for right now, this is the cheapest plan that's available. You'll see underneath that, it'll show you the drug cost and premium cost. If you have drugs as well, it will list them and it will list how much they'll cost you at the cheapest in-person pharmacy and the mail order cost if you select that. And it'll show you below that the drug deductible. And again, once you meet that deductible, then the cost sharing changes. If I put any pharmacies in as well, it would show if those pharmacies are out of network, in network, or preferred in network. Generally speaking, you expect that you're going to get lower cost if they're preferred in network. Now, this is a Medicare Advantage plan, and there's more for it than I can fit on here because, and I mean a lot more. This isn't a 1 or 2 slides. This would keep going and going. So if we do a plan comparison, we can go through the details and look at how much this procedure, that procedure, this type of procedure cost. But generally speaking, you'll see whether there's a premium for the plan itself on top of the $164.90, the Part B premium. You'll see if you put any drugs, what the cost for that will be. If there's a health deductible, in this case there's not. In this case there's not a drug deductible. And because this one is a PPO, you'll see that it actually lists in and out of network and in network maximum out-of-pocket cost at the very bottom here. So if you make all of your care entirely in network, the maximum you pay is $7,550. I was close. If you go out of network, then that can make the cost as high as $11,300. Again, because it's Medicare Advantage, it can cover things that original Medicare does not cover. And it'll show you on the side what those would be. Vision, dental, hearing, transportation, which is what it sounds like. Fitness benefits is often silver sneakers. Some of these are a little vague, I'll admit. Worldwide emergency, telehealth. Now, you'll see that this one covers over-the-counter drugs. Again, that might very well mean that there's a card that you get where every month or every quarter it's loaded and you can spend that on over-the-counter drugs or groceries or whatever your plan allows for. Sometimes emergency response device might be a life alert, something like that, in-home support. You can see what they cover, and we can go into even more detail if we look at the plan details for a particular one. This one just happens to be the first one that comes up. And also you can see the copays on the side. For a primary doctor, the copay is $0. If you need to see a specialist, then it's a $10 copay. All right, and then lastly, again, open enrollment. It's that time of year coming up. It's October 15th to December 7th. And it's what allows beneficiaries to switch plans, again, from one prescription drug plan to another, one Medicare Advantage plan to another, or you can switch between those. That isn't true for Medigaps. You can sign up for those any time of year, and we can help you with the plan comparisons. Again, especially during open enrollment season, that's the bulk of what we do. So if you want to come into the office, or if you need to give us a call, or if you want to set up a virtual conference, I or any of the volunteers will be able to help you out with that. We'd be enrolling you for plans in 2020.